as we're saying, this is electrical device. So our brains performs in such a way that it's always discharging, discharging. Just as I may be using my phone from one app to another and it freezes for a moment. This is what happens in individuals with the epilepsy. Their brain discharges abnormally that will make this person lose or control of some of the movements, their feelings, and sometimes loss of consciousness. So this happens for a brief moment, from seconds to minutes. And that particular moment when the brain abnormally discharges, that this individual loses control.
Discharging what?
Electric impulses, literally. Yes. Just as a phone may freeze for no good reason. That's what happens in our brain. It fires a lot, too much electricity in the head, that you lose control of your movements, of your consciousness, and sometimes of your feelings. So that particular moment, we call it a seizure. That brief moment, that brief disturbance. So if an individual has a tendency of having such occurrences happening once more and more and more, then that person will refer to them as having epilepsy. So it's literally a condition of the brain which will result into abnormal firing of electrical discharges, making these individuals lose control of their movements, their feelings, and their awareness. However, it presents differently depending on which part of the brain is being affected and to the extent of the dysfunction of these electrical impulses.
Wow. I feel the illustration was very, very important, and how you said that if the brain is like a phone, and the movement from one app to another app, especially if you open the bigger apps, and they can overfreeze the others, and so much more. Thank you so much. Now, of course, we would want to run into the signs and symptoms. Then from there, we go to who is at a risk of getting this very disease. Is it even transmissible? If I have it, can you get it if we share a bed?
Not really.
Is it like mpox?
It is not contagious.
Please go ahead and explain to us.
It's not contagious. It is non-communicable to begin with. So today we are going to be sharing about medical information and some practical skills we can always use at home. So we are going to start with literally, what are the causes of epilepsy? If you talk about epilepsy and people hear this word, what's really the exact cause of this? There are many causes of epilepsy, and among which we have if things that even occur before we are born. Yes, if at all my mother or a pregnant woman falls and injures this baby when the baby is still in the womb, there might be some abnormal development of the brain causing this child to start having seizures when they are born. We also have birth traumas. These are injuries which occur when a child is being given to birth, especially via the birth canal. We can have others like infections of the meninges, infections of the brain, and of course untreated cerebral malaria. Some people, their epilepsy started as malaria. It's because so severe that they were not treated as kids, and then they started having these recurrent seizures on and off, and then they end up having epilepsy.
Could you please echo more about malaria? Because we've seen that malaria has become a normal condition, a normal disease here in Uganda, and it is one of the leading causes of mortality here in Uganda. So can you give more emphasis on how prevention of malaria can lead to the decrease of epilepsy cases here in Uganda?
Thank you very much. As we know that malaria is one of the illnesses that increase our core body temperatures. So we talk about febrile illnesses. And then if malaria is not treated at an early stage, it may progress more to affect the brain cells, leading into cerebral malaria. So as a result of high increase in high temperatures, it may result into our brain cells to fire abnormally those electrical impulses, triggering what we call seizures. And then from time to time, these seizures may become recurrent. Every time a child has fever, they always get these seizures, and then they become epileptic. That's why we advise parents, when a child become febrile, when they become hot, like when temperatures increase, please rush them to the hospital to cool down those temperatures, because high fever can of course precipitate or trigger an epileptic attack.
Perfect. Thank you so much. And thank you for the emphasis about malaria. Dear friends, those who are watching, if you develop a fever, do not prescribe yourself treatment. Do not think that the problem has gone. And of course, we want to prevent malaria. Thank God that now the vaccine is in Uganda, actually. Very soon we shall host a senior consultant who will be telling us about how to access this vaccine, how effective it is, and so much more. But I would also want to inspire you and bring you on board on how epilepsy can be progressive and how it can actually result from the malaria that you disguised, that you took carelessly, that you thought maybe it's not a serious condition. Now, having looked at that, we want to dive into who is at a risk of getting this epilepsy. We've talked about a little bit of the risk factors, malaria being inclusive. Could you please continue to exhaust them?
All right, thank you very much. I need people to understand that at any age, any person can have epilepsy.
At my age right now?
You can get epilepsy.
Oh my goodness.
Yes. So epilepsy can affect all ages and all gender, irrespective of what work you do.
Where is it common more?
It is especially common in children because that's where we tend to diagnose it more.
Okay.
However, as we're talking about risk factors, we can have a 50-year-old who might be a victim of a road traffic accident, which may injure the head. And the result of this head injury, you start having these recurrent seizures.
Okay.
Which as a result of the head injury or old age actually. And then you start having these recurrent seizures. And if you have a tendency of having more than 2 in a year, then definitely you have become epileptic.
Okay.
However, we must be very keen, especially to our children, when they get fevers or when a child have the first attack, which looks like a seizure attack. Please always take them to the facility so they can be examined more. Because not every seizure is epilepsy.
Okay.
However, everything has its first time. It may be the first time presentation of that particular child, but I want to tell people that everyone is at a risk. As long as you have this brain, and then at some time anything can cause this brain to discharge these electrical impulses abnormally, and then you become a palpate or you become a victim of epilepsy.
Okay. Now, having looked at that, one now to talk about the myths and misconceptions about this disease. We earlier talked about, did we say that epilepsy is not infectious?
Epilepsy is not infectious. It is not contagious. It is typically non-communicable illness. You cannot spread it from one person to another.
Because it is very, very rare. You know, people want to hear facts.
Yes.
And that's why I encourage them to follow us on social media platforms and drop in your comments, your opinions, suggestions, and how you feel about this very program. Remember, if you are watching us from wherever you are, just put your comment. Share your expertise. Share what you've ever heard about, for example, epilepsy. It helps us to know the magnitude and the knowledge, maybe the experience that you people have, depending on different diseases. Now, Mr. Christopher, if you say that it is not infectious, that means we can live with these people, we can hug them, and sleep with them.
Yes.
It is not transmissible in any way.
It is not. It is not.
That's perfect.
However much we have a genetic vulnerability, that if I come in a family with a member who has epilepsy, there are some significant chances of me having a child with epilepsy.
Okay.
It is just a genetic vulnerability which can run through the family. However much there is no specific gene or whatsoever which has been identified to carry epilepsy from the parent direct to the child. However, my grandfather might have had epilepsy, and then my grandchildren also have epilepsy. It can have that tendency. However, there is no direct transmission from one person to another, just as HIV is, or as malaria is, as any other illness. So this illness, we have a lot of misinformation, means fear and social stigma that is always associated with epilepsy. And I want to correct it with the people. Epilepsy is not contagious. Epilepsy is not as a result of evil spirits or people who do bad things. It is a medical condition, just as people have diabetes or hypertension. It is a neurological condition affecting the brain. It is purely treatable, and it can be managed. And actually 70% of the people who are taking these anti-seizure drugs can be seizure-free for the rest of their lives.
Serious?
They can live a normal and productive life like other people.
How about the local herbalists who say, please, if you have this, haven't heard about them, that please come, then we give you some treatment. It can take away all this. And
we have had stories of individuals.
Haven't you encountered patients who have
I've
gone?
counted them actually.
Share your experience.
I have encountered some patients. You prescribe them drugs. They take them for 1 month, 2 months, 3 months, and then along the way they find some so-called herbalist who gives them some things to take, and then unfortunately they come back when the baby has severe burns, when the seizures have just increased.
And are those some of the neglected complications of seizures or unattended to seizures?
Yes, if you don't take those drugs, if you don't go for treatment literally, those are some of the complications which will happen. As I told you, that some people may have sudden falls, sudden loss of consciousness as because of this epileptic attack, and they stop taking these drugs we give them. Some people tell them that there are some other drugs which they can use really to control these seizures, which is literally wrong. Seizures can be controlled by anti-epileptic drugs.
Okay.
Not those specific. I don't know what formulations they use, but some people take them. And what's funny, they may take them and the child be like 3 weeks without any problem. But then along the way things become too much. Someone who used to have one seizure like in a month, one episode in 3 months, they start having current almost 3 in a day. And remember, the more you have the seizures, the more you damage the brain.
Okay.
And this predisposes even to more neurological deficits and other cognitive dysfunction.
Perfect. Thank you so much, Dr. Christopher. Dear viewers of Google Data Vision, I want to once again welcome you. I want to once again interest you in our topic of discussion today, which is epilepsy. And of course, epilepsy, it presents in form of seizures and so much more, just like Doctor is explaining for us here on Google Data Vision. But also, I want to interest you to visit our social media platforms. Remember, Google Data Vision is on YouTube, Facebook, Instagram, Twitter, or formerly X. And you can share your opinion, you can share your expertise and your information about this very condition. But the most important thing Dr. Christopher has said that this very condition, 70% of the persons who live with it can be seizure free. Yes, can be totally seizure free if you are consistent on medication. That means this condition can be stabilized. Then why not? Why shouldn't we pay attention to our health? If you have any sign or symptom that can detect out that this might be epilepsy, come and seek treatment. Come and seek help from the experts, and then you will be supported. But of course now, you said that this condition is treatable. Do we have the available treatments? Or it's just stories?
Treatment is there, and it is relatively very cost effective. I think in majority of government facilities we can find these drugs, and it is treated actually from even the primary health centers. You can get treatment of epilepsy. Does not need so much super sophisticated, specialized hospitals to treat epilepsy.
Does not need to travel to India.
Does not need to travel to India. Yes, as long as the medical workers are trained in the recognition of the symptoms, the assessment, diagnosis, and then they can offer the common drugs we use. Because these are anti-epileptic drugs. They are there in government facilities. What I would like to tell people is not to self-prescribe these drugs to themselves. Just because you saw someone's child having a fit last month, and when your child have the same fit, you rush to buy these drugs.
No, you ask your neighbor.
Not really.
And then your neighbor helps you out.
No, you have to take the child to the facility.
Because remember, the health facilities are very far.
Not always. Even they can give pre-referral treatment.
And health workers are scarce.
Health workers are there. Health workers are there.
Encourage our viewers to ensure that
our
they
dear
visit the
viewers,
facilities.
Trust me, sometimes the bigger facilities you may wish to take your child may be far away, but even at Health Center 3, they can manage this. And if they can't, they give pre-referral treatment. They give the child some injection, and then this child is referred to a bigger facility
in
case they cannot manage it.
Yes.
Where they can do further testings, and then they determine the exact cause. Because as I told you earlier, not every seizure is epilepsy.
Okay.
Some people may
And
just
not
be
every
too
epilepsy is
hungry
a seizure.
after starving.
Mm.
Maybe they have electrolyte imbalance, they are dehydrated, and then their brain behaves in such a way.
So those are differential diagnoses
Those are
of
different diagnoses of a
epilepsy,
seizure.
or some of I think we need to explore them.
Yes.
So there are some other signs and symptoms that may masquerade to be epilepsy, which may not be. Please, can we talk about them?
All right, thank you very much. There are some conditions which may cause a child or a person to have those brief moments of loss of consciousness,
Of the brain
freezing a bit, or short circuiting and mimicking what we call seizure. As I told you, for someone to have epilepsy, there must be a tendency. Like, it doesn't happen once and you say you have epilepsy. No. It may happen today and then it happens maybe some other time, but just a one-time thing does not necessarily mean that you have epilepsy.
Okay.
We have some other conditions, just starving. Starving when your brain lacks enough glucose.
So it may typically, maybe you can say when you do not meet your dietary requirements, or maybe when you are hungry, when you are not able to access the food.
Yes, like after starving for a long period, you can literally behave as if you have epilepsy. And those other people with other febrile illnesses, a child may really be too sick, they have high fevers, and then they start to have these serious fits. Doesn't necessarily mean that they have epilepsy, but they are that particular moment they're having a seizure, but not necessarily as a result of epilepsy, a neurological condition. It may be just, sometimes it may be malaria, but if it is not treated early, it can progress from being a one-time thing to something which is recurrent, hence becoming epilepsy. Wow. That's why we should always be vigilant. When a child is sick, the most important thing is to always seek care. However, as I told you, the misconceptions, the misinformation, this fear and the social stigma surrounding with epilepsy make these individuals even fear the symptoms more, fear the individuals or the people, the communities more than the illness, hence not seeking care. And if they don't seek appropriate care in time, it means there are a lot of likely risks and complications that may happen as a result of not seeking treatment when someone has epilepsy.
Perfect. Thank you so much. Now, before we go for a short quick break, I want us to talk about the complications of unattended to epileptic patients. Like 5 major of them, even if they are adults and maybe young children. What are some of the most complications that you've gotten from people who have relapsed cases of epilepsy?
Thank you very much. Individuals with epilepsy are at risk of having a number of complications stemming from physical, psychological, and even behavioral issues or complications. And among the physical, as I told you, if you don't treat this epilepsy in time, you may have recurrent seizures, or when it is prolonged, someone starts to fit for minutes. And remember, the brain is being affected. It is a condition, we call it status epilepticus, which is an emergency actually, because it can result into death. When a child have recurrent seizures without a break, like someone have these convulsions without regaining consciousness, another one continues, that happens as a result of unattended to epilepsy. We have severe accidents. Maybe someone have several falls and they keep getting burns, they even drown in water, they get those home accidents majority as a complication of unattended to. And then it is with unattended people with epilepsy, when they are not attended to, they are 3 times more likely to die than any other person. So we may have that sudden death in epileptic patient as a result of being unattended to. And then psychologically, when you imagine you have this condition, every now and then you are losing consciousness, it will literally affect you. For example, if it is a child, that child may not progress academically, may start missing school, and then the social stigma associated with it. This person may have even issues in forming stable relationship with other children at school. Yes, so
relationship,
it is very key, even in adults.
I have seen it on some ex on this page, how someone lost a relationship due to some medical condition that's related to this.
Yes, so if it's not attended, sometimes it might be hard to maintain a stable relationship with your partner as adults. And for children, having stable relationship in terms of friendship, people may start to fear you because of what they hear and what you're going through. But if you take these drugs very well, it means you'll be seizure free. Actually, not everyone can even tell that you have epilepsy, because you can come to work like here, you are free, you go back home, take your medications very well.
Wow. Thank you so much, Dr. Christopher. And of course, we'll go for a short, quick break. But when we return, we shall summarize our case study. It's more a case study. And then we shall develop the treatment modalities, prevention strategies that are available, and encourage you. And then we call the government, we call the individuals and the communities on how best to live with this very condition. Do not forget that I'm Kamara Daniel, your best presenter for this Health and Beauty program. See you shortly.
Good Day TV, transforming your life. Oyagala by'ofumba bijje mangu nga tofunye buzibu bwa mukka kosa bulamu bwo. Weekwate mobile stoves tukukolera ebyoto ebikekkereza enku wamu n'amanda, omuli ebyoto bya sola ebikozesa volcanic stones wamu n'olusennyente, nga tukolera ne biogas okuva mu busa, saako oven gattako sawuna eri gwe wawaka naawe wa bizinensi ku bbeeyi etakubya ntunnunsi. Kati naba amasomero, amalwaliro, awaka, amakanisa, factories, hotels wamu ne restauranti, mutuyite tubazimbire ebyoto bino ku ba 078 47 08 96 ne 0750 82 3 oba jangu ku offiisi zaffe Namugongo, Kyali Wajjara Road opposite Dawson Petrol Station, esangibwa kulidde ekireka.
Pastor Pasteri Music Center, located along Chagwe Road on Serwaniko Music Plaza. Shop number B4 in Justina Arcade. Shop number G73 next to Chiseka Market. Brings you all music and audio equipment and electronics like brass band items, including saxophones, trombones, and cornets, top speakers, bass beams, amplifiers, digital mixers, guitars, flat TV screens, keyboards, domestic lights and stage lights, code and cordless microphones, studio monitors, sound cards, and all recording studio equipment. For deliveries and orders from abroad, call Pastor Pasteri on 0752 00443 or 0782 008 443. Pastor Pasteri Music Center.
Good Day TV, transforming your life.
Television. This is Health and Beauty program. Once again, I am Kamara Daniel. I want to welcome you from a short quick break. We usually encourage you that when you go for a short quick break, if you've been seated for long, you encourage you to stand up, you encourage you to stretch around, walk, or most importantly, ensure that you're eating fruits and vegetables, and make sure you are buying them from organic farms, natural markets, from Kalere, Nakasero, and every other places that you can access these natural caring foods. Remember, nutrition, it's an independent variable, if I can say this. All other healthcare system directly depends on nutrition. If we take nutrition seriously, we can prevent over 75% of the healthcare diseases here in Uganda, particularly. I think Mr. Christopher should link nutrition to Epilepsy, and he will tell us how actually nutrition can improve the outcomes of epileptic patients here. Let's dive into the treatment strategies that are available in Uganda. Do you have phases? Do you have phase 1, 2, and 3? Do you have, I don't know. You are the one now who knows better.
All right, thank you very much. So we have a number of treatment options we use. We call them anti-seizure drugs or anti-epileptic drugs or anticonvulsant drugs. Like, they are the same drugs. So basically we did in lines that this is the first line, second line. If we give you this line and you are not improving on it, while other patients are doing, of course we have to change to another. Yes, we change to another drug. I wouldn't wish to dive more into the dynamics of the specific names and how they work.
No, those ones you can
really.
leave them. But most importantly is knowing that we have
them
treatment regimens available, developed by the Uganda Ministry of Health,
and they are actually in almost all government facilities.
Ah, that's interesting.
Yes, they are there, and even in pharmacies, they are cost effective for those who may not have access to them in government facilities.
Okay.
Those drugs are not super expensive.
Okay.
They are not. With drug strips starting at 2,000 plus, depending on which brand you want. But I can assure you all those drugs work.
2 people and 10 people, 2 in 10 people slept hungry last night and they do not have hopes of finding food even tonight.
I understand.
So it's very important to know that what may seem to be cheap, but we wanted the healthcare system to waive off some of these treatments.
Actually,
but of course but most of those drugs are usually there, even they expire in some rural healthcare facilities down there. Wow. Can we go to preventative strategies? Broaden them up so that our viewers can learn more on how to prevent themselves. Match them with the risk factors so that we can live better. With epilepsy, we're going to begin with those ones who already live with epilepsy, what they can do, and these persons who do not have the condition. Yes, please.
All right, thank you very much. So as we have learned that epilepsy may begin right away, even before a child is being given birth to. So if we're talking about preventive strategies, we can begin with attending antenatal care. Early enough, we always advise mothers to attend antenatal care early enough in the first trimester, in the first 3 months. Literally, they should be taking folic acid because it is very important for the development of the central nervous system, which is literally develops into our brain and then the spinal cord. So preventative strategies begin right away from antenatal services, if you attend to them, and then avoiding injuries. When children get sick, especially with febrile illnesses, please rush them to the nearest health facility, have them checked, tested, and treated. And then for individuals already living with the epilepsy, the advice is to please stick on with the drugs. I understand the burden of taking drugs on a daily basis, but for a better productive life, it's always important that we understand the significance. We understand why we're taking these drugs, and then we take them in time. And then, of course, to avoid some other triggers, like substances. It is really unfortunate if you have this illness, you are taking the drugs, and then on top of that you're adding alcohol. You are literally bringing treatment plus poison at the same time, and then it is not really good. So we must avoid some risk factors like alcohol, avoiding things like stress.
But stress is natural.
Stress is natural, of course.
In that day-to-day life,
everyone is stressed. However, there is this stress which we perpetuate ourselves. Okay. We draw deeper into them, and we always thinking of such things. At some time, this may precipitate an attack. Okay. And then having healthy meal, as you are saying about diet, we must know all in all that nutrition is very important. We need food for the normal development and growth of our brains and the normal functioning. Yes, so having a balanced diet is very key, especially for these patients. We always advise food which is high in fats than in carbohydrates, literally.
Actually, we talk about that's keto diet.
Yes, keto diet.
Yes, keto diet has shown a high improvement in persons living with epilepsy, according to studies by NHS. And we've seen that people who depend on keto diets with epilepsy and they're on treatment, their outcomes are far way much better.
Much better than others. That is very true. That's why we advise these people that nutrition is very key. Very, very key in the normal function of our brain.
So you're encouraging a multidisciplinary approach.
Definitely.
From this clinician, you refer them to
from the clinic environment to the home environment.
Okay.
What best we can do. And then most importantly, have enough sleep. Sleep deprivation can trigger an attack. Someone sleeps for 2 hours. The brain is overworking for 22 hours in a day. That is too much for the brain. This brain needs rest. So we always advise these individuals with, not even with epilepsy, any other individual, to have enough rest. It's
about
very
those people
good
who
for the brain.
oversleep? Because we also have people oversleep.
People oversleep. Yes, I get it. But whereas these people to have enough sleep, it is very key that to have enough sleep to prevent this trigger. And then have these flickering lights.
The disco lights?
Yes, not necessarily disco. Those color green, yellow, white. When they are flickering in such a manner, this alone
red,
may precipitate
yellow,
an
orange.
attack. So always advise these people to avoid such lights. And then loud noise. Loud noise may disrupt the way the so-called electricity passes through her brains. And then
loud noise, not music.
Sorry?
Loud noise, not music.
Yes, but even if it's music, let not be too loud.
When it becomes loud, it becomes noise.
Yes, definitely. So we always advise these people to avoid such triggers.
Okay.
Yes, that's very important. And of course, when they get sick, please, these antiepileptic drugs do not cure every illness on this planet.
Okay.
Someone may be like, I'm feeling feverish, but after all, I'm taking my drugs. Please, these drugs are only for that particular purpose. They do not treat all other illnesses on this planet.
So you can go ahead and
when you are sick, please go for further checkup.
Okay.
Yes, not these people of, I'm sick, I feel a little fever, I don't have energy, but after all, I have my Fento in here for my epilepsy. No, does not work like that. We advise them when they get sick, they have to go, because sickness is a physical stress to our body.
Okay.
Any stress can, any illness can stress our body, which may precipitate further attacks.
Okay.
So it is very important that these individuals living with the illness, they go and get tested and treated for them. And then the families and then the communities we live in.
Okay.
Because families play a vital role.
Social environment.
And the communities in which these people
they determine
survive
even
in.
the recovery rates.
Yes. And even drug compliance. Because if the family members are not supportive, emotionally, physically, and even financially,
I'm telling you.
yes, so it may be really hard to treat these patients if the family members are not supportive. That's why we urge these family members that a person in your family, if they have epilepsy, it's not like any demonic kind of issue. When you go closer to them, you won't get the illnesses. Bring them closer, treat them as people, because they are individuals capable of living a full life to their potential and being productive to our communities.
Wow.
But the more we do this social stigma, the more we segregate ourselves from them, the more we push them away, we are losing even productivity as a community. That's why we call upon everyone. Teachers at schools, they provide a role, because especially children may have epilepsy. And if the school administration is not concerned with these children, then it may be hard to help them out. They have to be even reminded to take their drugs because they're children. And then the social stigma is what is very important, because if we do not dispel it, trust me, it will be hard to manage these individuals.
I feel the stigma comes from the moment I stand out to say that I live with epilepsy. And in my own opinion, I would feel if I'm living with it and I'm in that environment, in any environment, I should keep it to myself and be on my treatment, live healthy, and it becomes part of my self-care. How do you see that?
It may or it may not help, actually.
But
I would advise, because in case of an emergency, maybe you forgot your drugs, maybe something has happened and then you have an epileptic attack. People may just be running away without knowing what exactly is wrong with you. I'm not saying that you should share your medical history with everyone, but of course in every environment we always find those people we confide in, those people which are close to us.
Okay.
So it's not a crime. It is not something bad to have epilepsy. Just as any person may have diabetes, as people may have hypertension, as you may have malaria or even a mere cough. It should not be something shaming. But you should get people you can confide yourself in. Let them know that I have such and such a condition, such that in case of an emergency, they know how best they can help out.
Wow, thank you so much. Thank you for encouraging persons to open up to the best friends they think they can confide in. But of course, I've also seen this on social media, that who's your friend? Oh my goodness, that you shy today, tomorrow it's in 100 people. In a way, I believe there are those two people who are good, and I pray that God allocates to the persons who can keep your secrets in case in one way or another. Now, let's draw a call to action to our government stakeholders, Ministry of Health, and to other healthcare practitioners. We are going to do them in three pathways. We're going to begin with the community, then we go to the health workers in the health facilities, both at at a public and private, then also the Ministry of Health as we conclude.
Thank you very much for that. But before we hear more of that, let's first discuss something small
Please
about the first aid management. In case you are at a workplace like this and then from nowhere our colleague shouts, fall down, starts having these jogging movements, what should you do? It's very important.
Please do.
Because number one, people may become anxious, and the anxiety just exacerbates the situation. So one of the things we should do in case of first aid emergency, like how best we can help this person, number one is to remain calm. As the helper, it's very that you are calm, because when you calm, you don't fidget, you may do things in the right way than having that anxiety. So always tell people, you know something you can do in case of an emergency. In case of something happens, you remain calm. Number one, you call for help if you can. Look through the surrounding and remove anything which may hurt this patient. Or if you cannot remove them all, try your level best, if possible, to remove this person away from the danger. But scan around, remove the danger, and please, if they're having jerking movements, don't stop them.
They should not tie them.
Don't tie them.
Why?
Let it will go away after some time, after a few seconds.
Shouldn't you pour water?
No, don't pour water. Don't give anything by mouth, because you may end up killing this person. Don't give anything by mouth. If there is a pillow around, just get a pillow and then put the head on the pillow, like put a soft cushion over the head, just to stop any physical injury which may occur as they are moving around. And then when they have stopped the fitting, you may help them lie on the side. On the left hand side like this, they lie like that as you call for help or an ambulance, or you arrange to transport them to the nearby facility. And if you know of their treatment or their drugs, please correct their items and go with them for further management. But number one, let's not avoid panicking. Let's avoid those things, the demon has attacked and stuff, run away. These are people, it's a condition, so you have to remain calm, help them out, remove all the things which may hurt them. And as we hit to the point of call for hope, this goes for all the communities we live in, because I'm pretty sure in every community there's a person living with epilepsy.
Of course.
It might be a neighbor, a relative, close family member, a friend, or any other person, but living in that community. The best thing we can call out is for people to understand that this is a medical condition, number one. It's a medical condition which can occur to anyone. Me, my children, my parents, my friends, and everyone can have the same illness. So we should help, or we should tell them to stop stigmatizing these people, to stop assuming that they don't understand other people. These are normal people, and we will really call out to the community to have empathy, to understand these people from their perspective, to understand that they are going through something, because the more you speak ill about them, the more you bring more mental health issues in them. These individuals may get depression, may get anxieties, and then they resort to other negative coping strategies, which may even further exacerbate their condition. And then to the family members, it's really a humble call. Please support these people. Emotionally, financially, be there for them. It's not like they have to be babysitted on a daily basis, because we want to give them that liberty to express themselves fully. We shouldn't limit them in capacity. The same goes to our bosses, our employers. A person living with epilepsy, there's no rule which says they cannot handle office work.
Okay.
They can do other people. So we always call out private investors, employers, and other sectors, private sectors. Please employ these people. They can live a full productive life.
Okay.
They can live seizure free and do their work. I know some of the doctors who are epileptic, but they do a lot of
let's
things.
have a correction to the Ministry of Health as we intend to conclude.
Yes, a call to the Ministry of Health is really, these are our stakeholders, our bosses. We call upon them to always supply these drugs, because we have deep communities where individuals cannot even afford to have what to eat. It may become tricky for them to travel distances and distances to come and access these drugs and reach when those drugs are not there.
Okay.
So we call upon them to always deliver these drugs in time to the deep and difficult accessible areas of the country, so that these patients can access these drugs and live a seizure-free life. And then to do more of continuous medical education to the staff. And not every health worker can be in position to tell that this is probably epilepsy and this is the best management, because in our country, sub-Saharan Africa, we have some big treatment gap in epilepsy. So we call upon other stakeholders and World Health Organization and other agencies to come on board, to train, to facilitate these knowledge gaps, so that it can become smaller and smaller as they tell, they teach, they help to add more knowledge to the health workers who are already in training and those who are already working, especially in the primary health centers. We want to bring the treatment of epilepsy from Botabika and the other super specialized areas to primary health centers, health center 2, health center 3, which is really accessible to the communities. That's a call to them.
Perfect. Thank you so much, Dr. Christopher, for sharing your expertise about epilepsy and for the good work that you are doing for the country, Uganda. And of course, I want to encourage us viewers and the lovers of Google Data Vision Health and Beauty program to keep on watching this program, because it's very important for you. I hope to see you next Wednesday. Take care, every person. Have a nice time. See you.
Good Day TV, transforming your life.
Light of the world, you step down into darkness.
I need to tell you something quickly, because with that consciousness is a great body. You are being introduced into a new type of consciousness about your nation of nationality, about the kingdom that you belong to. So even though you are here, you are not of here, you are not from here. It's a great body, because the consciousness that the Holy Spirit brings into your vessel gives you a responsibility to make a choice. I'll explain myself. A choice. Once upon a time in my journey of the gospel, I think I was 5 years into marriage already. And we had a posting that took us away from where our families were to Lagos. And in Lagos, there was this lady that showed up. And according to her, I was revealed to her as her boyfriend. It was a disclosure. And I need to give you some details here. The lady is extraordinarily beautiful. As if they brought her from ice block, you know. Amen. Now, so if you look at the lady, your flesh would desire her. Right? But that's not all. Because the Holy Spirit is in my spirit, even though my flesh desires to even kidnap her, but the Holy Spirit in my spirit begins to unveil in my heart the values of the kingdom, of my nation, of nationality, and what I need to do to be an accurate ambassador. Are you with me? No, I heard somebody praying one day, that it's a take flesh away. No, that's you won't take. There's no such prayer point in the Bible. Flesh. Flesh will still be there. The idea of the Christian life is that the energy, the capacity of the Spirit of God in your spirit is superior to the energy of lust, of flesh, of sin.